Welcome, everyone. At this time, I would like to thank the RNAO for all the great work that they do and continue to do by giving organizations the opportunity to share successes. And I would also like to thank you all for joining me today. My slide's not moving.
If you just highlight the little arrow on the bottom corner.
I can't move them either.
No, you don't have control right now, it's just Kelly.
Okay.
Yeah, it's not moving.
Do you see the little arrow on the bottom left-hand corner? If you just move your mouse over towards it.
Yeah, not working.
Okay, I will move your slides for you.
Okay, I'll just say next. So next. So this presentation is really the journey of the home, how we work together as a team to improve communication and implement new strategies to enhance the lives of our residents with a holistic approach. Hopefully at the end of the presentation, you will be able to utilize some of the tips, tools, and resources provided, as well as share your own successes so that others too can continue to further support with education and networking towards a person-centered care approach. Next. Next slide, please. Watford Quality Care Center, formerly Watford Nursing Home, opened in 1979. It is nestled on the outskirts of the small community of Watford. We are happy to have a portion of our dedicated staff serving over 25 years. We welcome new staff and students who, in return, assist us with embracing new techniques and ideas. Next slide, please. My name is Kelly Kallenberg. I am a healthcare aide, now grandfathered personal support worker. I do think that PSWs are sometimes undervalued because they are not registered staff. This is far from the truth. PSWs are the backbone of long-term care and a vital part of the organization. Give them a chance to shine, as they are the ones who are going to assist you in meeting the goals for this guideline. They spend the majority of the time with the residents to create relationships that will assist in measurable outcomes and sustainability. I would like to thank Watford Quality Care Center for giving me the opportunity to be the lead for the Person and Family-Centered Care Guideline. It is a privilege for a PSW to lead in the implementation of an RNAO guideline. Next slide, please. We started our BPSO initiative in the spring of 2019. Our guidelines were selected. They included pain, diabetic foot ulcers, as well as person and family-centered care. We completed the gap analysis for the guidelines and sent 14 staff members to attend the Champions Workshop. Manage made the decision to have all of our champions attend the workshop together in the beginning as a team. Right away, this completed one of the deliverables to have 15% of the staff become champions over the 3-year period. This worked out to our advantage as we were able to work together to raise awareness, assist with collecting information, completing audits, and implementing small changes. Champions do serve an important role. Without them, it would not be possible to make all the changes necessary to engage others and complete the goals that we want to achieve. I will go more in depth about the effective utilization of the champions a little further along in the presentation. Next slide, please. I really wanted to highlight the use of the gap analysis. This is the actual copy of the RNAO gap analysis for the Person and Family-Centered Care Guideline. The information from the gap analysis is used to evaluate where small improvements are needed or areas of a higher level of concentration are required. So along with our RNAO coordinator, our BPSO lead team completed the gaps for all 3 guidelines, even though we were only required to complete 1 guideline per year. At the time, we just thought it was a good idea to get all the gaps completed, and then we could slowly introduce new ideas and implement some new strategies. In reality, it really was a huge benefit to us to have them already completed when the COVID-19 mandate started and the new and constantly changing pandemic protocols also needed to be implemented. The utilization of the gap analysis is one of your most effective tools, and it is the initial completion, it is really your jumping off point. If you can't identify that you have problems, you won't be able to change them. Next slide, please. So again, by using the gap analysis, we identified areas that we needed to make some changes and improvements. We also looked at why we needed to adapt this knowledge and what might be preventing us from obtaining our goals. The adaptation of change is viewed differently for all of us. Sometimes we embrace change and sometimes we resist it. I felt with the pandemic becoming a reality, none of us were really prepared for all of the changes that we were going to endure. Next slide, please. I would be lying if I told you it wasn't a smooth ride. We have definitely faced some bumps, detours, and some barriers along our journey. Staff involvement and buy-in are extremely important and promote a whole home approach. I would highly recommend and encourage you to have your BPSO launch sooner than later. Due to COVID, we canceled our launch. Not having a launch has impacted staff engagement significantly. It has been a challenge to get everyone on board with new strategies, but I think that with anything new, there is always some resistance in the beginning, and eventually the changes become the new normal. Some of the new strategies we have implemented actually involve going back to pen and paper. Examples of this would be hourly rounding and the integration of the daily report and tip sheet, which I will go into more detail in the next few slides. On a positive note, some of our champions have been working on a smaller scale launch set for next month. We have high hopes that this will raise more awareness throughout the home, as well as motivate staff to increase the support for positive outcomes that are promoted through the BPSO standards. Next slide, please. So far, we have made some significant changes throughout the home. We have developed and integrated some new strategies. We have also continued to utilize some of the existing pieces and BSO assessments, but have provided more education to assist with better data collection for the person and family-centered care approach. Person-centered language is also important, as words can be powerful. What words we choose, along with body language, can impact others' behavior significantly. I will follow up with some additional resources. The completion of the All About Me page for each resident can act as a great tool, giving staff key information about the resident's likes, dislikes, and background can not only be a conversation starter, but give insight on who they are as a person. Along with the 27th-line video, brings the resident's Bill of Rights into perspective. If you think you are doing a great job respecting residents and you have not watched this in video, I encourage you to do so. It will help you to understand what you need to do to change. It will give you a different perspective and show you that you may need to shift your philosophy, especially if you are a task-oriented person. There are 27 Bill of Rights, and it is part of our mandatory training. If you choose to implement the Through Our Eyes program, you will successfully achieve the Person and Family-Centered Care Guideline. Next slide, please. We wanted to create a working tool to ensure that continuity of care and it was consistent. And we wanted to improve communication amongst the interprofessional team. We utilized the daily report sheet for each shift. It's a communication tool for the PSWs to communicate with the registered staff regarding resident observations, findings, and concerns. There is also a place for registered staff to follow up or to clarify prior to inputting the information into the point-click care. It is also a shift report for incoming staff as to what has been happening on the unit the previous shift. The flip side of the sheet not only has tips with dislikes and likes for each resident, it is a quick, detailed care reference for each resident on the unit. It provides details of diet, toileting routines and products, bath days, assisted devices needed, oral care, etc. This is a great reference for new staff or casual staff to use and ensure that the residents' care and needs are being met. It is easy to use and easily accessible. It is handed in to the registered staff towards the end of the shift for review and further documentation. While creating this tool, the use of the champions played an important role. We needed consistent and constant feedback. Questions we kept asking ourselves were, is this working? What did we miss? What do we need to improve on? Again, this continues to be a working document. The RN updates on a nightly basis. It can easily be revised and additional information added to support the changing needs of the resident. Next slide, please. Supporting pandemic has been a challenge for many residents. Isolation to the facility and not being allowed to see family is difficult for many. Social distancing in and amongst the home can also be a challenge with persons with dementia. Many wear glasses and are hard of hearing, and now the familiar faces of staff that they thought they somehow recognized are all wearing masks. So sometimes small changes to us have larger effects on our residents. I always felt that a blanket warmer would be a great idea. Some residents are always cold, and I thought it would be comforting to them. Then we got one. I cannot believe how something as simple as a warm blanket can decrease some behaviors and ease some anxiety. In a time and a place where family is limited to see loved ones and hugs and human touch are discouraged, a simple warm blanket has made a huge difference in comforting our residents. Communication with family has significantly changed and is more frequent through calls, Zoom, emails, and Facebook. Informed changes are important as well as pictures and videos of their loved ones. Our staffing hours did increase due to some extra funding for summer, and the PSW hours were adjusted to better accommodate residents' needs. We initiated hourly rounding and daily report and tip sheet, as well as provided staff with a wellness center. Next slide, please. The look on the residents' faces says it all. With creative thinking amongst our activation department, our residents stayed happy and engaged in activities they most enjoyed. Window tic-tac-toe was a hit with our resident. It also provided some range of motion to clean the windows and play again. Canada Day is very important to our residents, and they enjoyed the beautiful day outside and sang the national anthem. Everyone's favorite, with a new twist, social distancing bingo, and special treats of ice cream, campfires, and lemonade provide extra opportunities to increase fluids during the hot summer, or just the simple pleasures of smelling flowers, reading, and music. Next slide, please. Again, communication with family is extremely important for our residents. I just wanted to highlight that we were recognized for our outdoor visitation station in the Erie St. Clair Behavioral Support Summer Newsletter. We have recently started inside visits with a designated room and all the protocols and procedures in place. Just this week, we have had to discontinue its use. Hopefully, it is only temporarily out of service. Next slide, please. I think all anyone wants in this world is to be themselves. We as caregivers need to accept and embrace people for who they are and who they want to be. It doesn't matter what race they are, what language they speak, if they are transgender, or if they have dementia. Everyone has the right to be treated with the utmost respect. These are just a few of the techniques and services we use to enhance the quality of life and the purposeful well-being of each resident. I would like to highlight just a couple. The robotic cat is a favorite. I like to call her Ginger, but any name will do. She meows and purrs as well as moves her arms and rolls over. She's very cost effective and provides great companionship. She also has a mute button if needed. The Lucent Interactive Magic Table shows a projection of images and different games and activities. Our residents love it. They can play math games, pop balloons, touch fish, sweep leaves, or even whack-a-mole. We have used pool noodles for residents to reach further on the tables, increasing range of motion. It provides great physical and mental stimulation for those using it. A motorcycle was also brought in for one of our wheelchair-bound residents to watch and support individualized stimulation. A flashback to the 70s promoted peace, love, and internal grooviness. Staff and residents were able to take a tour around the home in our very own Volkswagen bus as external bus rides were on hold. Also, prior to COVID, we had been in contact with Sarnia Pride and Transgender Association, and they were coming into the home to provide visits and support for one of our residents. Next slide, please. There are a few areas that we saw an opportunity to improve upon to better the resident and staff relationship. We did need to do some rearranging of the dining areas to meet social distancing protocols set forth from the ministry. We did have to be careful and give some input to our residents and explain why there was a need. A few months earlier, we had a resident who was moved from his dining table to another. He wasn't asked, he was just moved. He refused to come to the dining table and he refused to eat altogether. When I went to see him as behavioral support, he voiced that he wasn't given a choice. He felt disrespected and he liked and missed his table mates. This is a great example of person and family-centered care. Simple solution. He was moved back to his table and the behavior stopped. Prior to COVID, we did some adjusting to our bathing schedule. Each resident was spoke to and asked if there were specific days they would like. Some even chose to only have one bath per week. We have a specific bath tip sheet that assists staff in the tub room with the residents' individual preferences. Language itself is extremely important. We need to be cautious in not only what we say, but how we say it and the words we choose. The Alzheimer's Society has a great document on person-centered language that is also a useful tool. It not only provides us with better terms like apron instead of bib, or brief instead of diapers. It goes one step further. It explains terms that should be used and avoided when speaking with and about people with dementia. It supports personhood with dignity and respect, and validating behavior such as a means of communication so that they may have a better understanding and acceptance of that individual. It can assist in shifting focus as behavior has meaning and how actions, reactions, and body language can affect situations. Staff education has been provided and resources are available. We also have a number of residents who do speak different languages or speak English as a second language. To support a person-centered language approach, we have consulted with family and some have provided us with common words and phrases that are useful. Next slide, please. These are our personalized surveys that we use to collect data and are used for satisfaction. Residents are encouraged to fill them out if they are able. Family may assist if need be. The big surveys are filled out on a yearly basis, and all other complaints are dealt with as they arise, tracked monthly, and used for the Inquire data. Staff are also encouraged to fill out the yearly staff satisfaction survey to assist management to see where there may be gaps in communication and assist with improvement as an overall team. Individual staff evaluation is also conducted yearly, where staff can rate themselves and set goals if they so choose. Next slide, please. Here is just a few examples of evidence of success that I have mentioned throughout the presentation. As we continue with the BPSO initiative, the list keeps getting longer. Next slide, please. These reports were created with the information that was submitted through the Inquire data. We started inputting our data in July of 2019. The first bar graph in the pink shows the rate of our complaints, and the overlaid line graph shows the nursing hours per day. We can see that in October, our rate of complaints received is about 97%. The second report is from the beginning of the year until now. In February, we have a little bit of an increase of complaints to 37%. This is shown in the purple. In March of 2020, we can also identify some things happening. Despite being mandated to close to public, our complaints remain at zero. COVID funding provided us with extra staff, increasing our nursing hours per day. The overlay line graph shows the decrease of nursing hours per day when the funding ended in August. At this time, we have been able to maintain our zero complaint rating. Next slide, please. The champions were assigned specific tasks and given a dedicated time to complete them. They assisted in the collection of information, completing audits, and implementing small changes. We had our champions all watch the 27th Align video and switch out staffs on the floor so everyone could view it. They assisted the activation department in gathering information for the IM storyboards, gave feedback, and helped with changes for the daily report sheets and room audit. I just want to point out that the photo in the top of the slide is actually a picture of our outside staff door. This is what greets staff each day as they enter the facility. Next slide, please. This is our wellness room. At this time, it is a multi-purpose room that also substitutes as our BSO office. So it is evidently a wellness room for the entire building. Management wanted to create a space where someone struggling could just go and be calm or take a time out for a few minutes if needed. It is a safe space, and everyone respects the use of it. Stress management is really important as COVID has created a sense of loss or grieving for some of the residents and staff. It is important to keep the mental health and well-being of staff a high priority and create a positive atmosphere to work in. Some of the items that are accessible to staff are essential oils, snacks, music, massagers, weighted blankets. We also have a blanket warmer, a daylight sun simulator. Positivity quotes are also placed on almost every door throughout the facility. Happy and healthy staff who enjoy their work create a more welcoming home environment for the residents. This is an asset and enhance the entire approach of the Person and Family Centered Care Guideline. Next slide, please. So just to recap, I've identified the gaps, we've determined strategies and developed resources. We continue to improve on communication and consistency as well as monitoring sustainability, and we have integrated person and family-centered care into every aspect of the organization. Next slide, please. Along with this list of resources that we frequently use are some photos of our amazing staff. It is unfortunate that I could not take any large group photos. A huge thank you to all our staff. Each department is unique in what their job entails, but in the end, the result is the same: quality and compassionate care for our residents. I want to make a quick reference to the bulletin board in the middle of the screen. This board was placed in our staff interest, and it consists of positive quotes and gratitude from our residents to our staff. It reinforces that our job is meaningful to them and that they are appreciated. This is a full circle of respect, and it clearly continues to support our effects of implementation of the Person and Family Centered Guideline during the pandemic of 2020. Thank you for listening.
Kelly, that was an awesome presentation. And I just want to tell you from the chat box, there's a lot of interest in some of the ideas you've shared with the group. And I just want to point out that transformational leadership is very important in any implementation in an organization. And Watford Quality Care has done an amazing job at empowering all their frontline staff. Their champions include an RN for the pain guideline, an RPN for the diabetic foot ulcers guideline, and Kelly's a PSW that was the lead for the Person and Family Centered Care guideline. And she has done a stellar job at leading this work. And I really think there's some real interesting ideas that homes can learn from their experience. So we'll take time now for some questions. I have not seen any.
There's just a few comments that they would like the slides after the presentation, and everyone that is registered will be receiving a copy of them.
Okay. Will these guidelines be implemented into all long-term care facilities in Ontario? The guidelines are available for any long-term care home to implement. They're a free download on the RNAO website, or you can get a hard copy. And every long-term care home in Ontario has a long-term care best practice coordinator that will work with you in collaboration to implement the guidelines. So there's 14 of us in the province, 14 best practice coordinators. We're all assigned to a specific group of homes, and we all share and collaborate together so that we can support homes with ideas and new strategies that are successful that will benefit everybody in the province. So we're quite interactive, and the homes are really supporting each other in the province as well.
Bev, we do have another question. Other than Zoom and phone calls, how are family members included in the person's care and treatment? Kelly, do you have any input on
Is this for me?
Yeah.
Okay, can you read the question again?
Yeah, so it's just other than Zoom and phone calls, how are family members included in the person's care and treatment?
Well, I mean, I'm not sure how to answer this. Okay, so through the pandemic, you mean?
Yeah, I think that's what the person is meaning.
Well, I'm not sure how to answer it. Like, they call them and they're all asked questions.
I think people, Kelly, I'll give you a hand. It's
Okay.
Bev. I'm the coordinator for Watford Quality Care. I think during COVID, families weren't allowed unless it was end of life. And
right. We've had the outdoor visits as well.
Yeah,
the visitation station.
yeah. And then they had a lot of social media use, so families could, there was Facebook interaction, and they also did a lot of phone calls and window visits. So I don't think, if you're asking about direct hands-on care during COVID, that wasn't happening anywhere in the province. So I'm not sure if that answered your question.
We also had our physicians, they did their rounds on the iPad weekly.
Oh, that's good. So there's another question, Kelly. During the pandemic, just for the sake of time, I wanna get it. Many healthcare providers had no choice but to take an LOA due to personal health issues. How was the result of staff shortages managed in regards to time management and keeping up with person and family-centered care? Keeping up with new policies and demands during the COVID-19 pandemic was definitely challenging. And I think you sort of touched on that during your presentation, but I was also wondering if you could share how you found time to build capacity and, develop your person and family-centered care BPSO work during this time as well. So it probably would answer both. Your answer would cover both those.
Well, we had extra staff on as well. We had extra activity staff, and we had extra funding, so we actually put extra staff on as well.
And then each of your champions, of course, would be directed by the champions, like the 3 leads and the DOC and the manager, to have be assigned to specific tasks that would be incorporated in their day-to-day routines. But
yeah, and actually we were very fortunate because we didn't have a lot of staff or out shortage during the pandemic.
So there's another question. How are the delegation of tasks determined?
It was specific. Our management set out time for our BPSO, so then we were able to work on that. We all got together as a team and we decided what we were going to do, and we did it that way.
Okay. The next question is, can you work to support ALC units within hospitals?
I'm not sure what an ALC unit is.
Natalie, do you mind just typing in the chat box what ALC means? Patients who are waiting for LTC home bed.
I think the long-term care program, I'll answer that for you, Kelly. The long-term care program is mandated by the Ministry of Health and Long-Term Care to work with long-term care homes specifically, but I do have long-term care homes who will share strategies and collaborate and support by sharing what they're doing in their experience with the acute care sector, if that's, of any help. And when you're a best practice spotlight organization, there is recommendations to build capacity regionally by sharing your work. So that would be, they could share what they've done and their strategies with anybody in the area or in the province, actually.
Okay. The next question, is family included in admission?
Yes.
Another question, have residents been able to have visitors now, or is there a max number of people allowed at once or designated visitors?
We did have a few visitors, but that's all been stopped. We have no visitors at this time, but it was 2.
Okay. Since the pandemic, are the residents required to stay in their designated rooms, or can they still interact with other residents but keep a safe distance?
They are allowed to keep a safe distance and spend time with other residents.
Okay. Another question. Was one family member designated and allowed in during the pandemic?
Usually it was just one person, the same people that come all the time, but we have no concerns with that.
That was during the pandemic, Kelly.
Yeah.
I think it was just end of life, right? If somebody was.
Oh, with just end of life? Yeah.
during the COVID phase?
We actually had families were supportive. We actually had, because we have a certain entrance that they could come in on their own, they could come in that way, and they could just come in that door, we could screen them, and they could just go to the door that was, the room was right by the door. So there was really no concerns with that.
Nice.
Just to follow up, did you find family members struggled with the pandemic guidelines and no visitation rules, and how did you respond to their concerns?
Well, yeah, you're always going to have a few that are going to have concerns with that, but we did our best, and they understood. We live in a small community, so it's different than living in the city. Everybody seems to respect everybody, and it's a total different mentality in the country.
I think it's because a small community, everybody knows everybody.
That's
and
right.
all the staff too, yes. There's one more here, Andrea. I'm just going to read. It says, "Hi, Kelly. Thank you for the wonderful presentation and for highlighting holistic person and family-centered strategies that might be taken for granted but very important, such as a blanket warmer, having the All About Me information sheet, and having motivating YouTube video and Through Your Eyes program. Can you talk a little bit more about these? It sounds exciting."
Yeah, I can talk lots about it. If they want more information, they can actually contact me. My contact information is in one of the boxes.
I'll be emailing it to everybody. Okay, so another question comment. Your examples of PFCC demonstrate how small changes like a warm blanket can make a difference in the quality of life of the residents. Respect and regard of the preferences of the residents does not have to cost money and reinforces PFCC principles. Can you give an example of person-centered language used in the home?
Yeah, I gave a couple examples. Like we use aprons now instead of bibs. That's, I did give a couple examples. It's like very person-centered too, right? You have to be careful. Like you don't want to call, sundowning. It's their actions of what they do. So you have to be careful of not to label people.
I think the sheet from the Alzheimer's Society that Kelly had on the slide has all of the terminologies that need to be adjusted and what the appropriate response would be. So it's, or what the alternative language would be. So it's more person, family centered focused.
You can actually go onto the Alzheimer's website, and that is all there.
Okay, thank you. A question from Naomi. Are the visitors required to be tested before entering?
Yes.
Okay. How was person and family-centered care implemented for families who lacked technology literacy?
Lack knowledge and
Who don't have technology or don't know how to use technology, Kelly. So somebody,
well, we have outside visits. We had outside visits as well. So some of them came and did outside visits. They just didn't have technology, or we could call them. Another thing we did too is they could come to the window, and if it was cold outside, they could actually speak through the window with their phone, and we would give them a phone so they could see each other.
Okay.
they have a unique setup. Watford is all on one level, and they have a lot of windows at the ground level as well, and in their dining area and their recreation area. So it's easy to get social distancing and have, families visit with their loved ones on the other side of the window. I love the window tic-tac-toe. I thought
we actually had families come and actually would put up posters outside the residents' windows as well, saying that they missed them. And
Andrew, there's a question there. They want to know how to access the support of the 14 best practice coordinators. Do you want to put a link on the chat box?
Yeah, so in the email that I send out, I can send the link, and I'll also include Bev's email in case you want to email her, and she might be able to direct you a bit more too.
Okay.
Okay, Okay, another question. Do you audit compliance with the use of proper language, i.e. brief instead of diaper?
We haven't been, but that is a good thing that we could start to do.
Okay. How can we maximize the support we provide to residents who cannot adhere to the 14-day isolation in a person-centered way?
Well, we have been providing them with extra activities and stuff to do, like we actually bringing them, making them activity booklets, and we've taken them magazines and things to do, and we've actually taken the music. We've provided them with like a TV with videos, just try to get them to do things so that it is difficult when you're isolated for 14 days.
Okay.
Kelly, and yeah, I have to just intervene that Watford Quality Care didn't actually have a COVID outbreak.
No, we did not.
So they were lucky in that regard, because I don't think they really had to go through that experience. So Kelly, there's a question here. Can you explain the gap analysis tool again? Would you like to answer that, or would you like me to?
Oh, you can.
Okay. So the gap analysis tool takes every best practice guideline, just to give you a little bit of background, has a list of recommendations about what you need to do to implement that guideline. So it sort of provides a guidance for what you need to know, what you need to do, and what organization needs to do to support the staff in providing the best possible care based on evidence. So we took the recommendations, put them in a chart like you saw in the presentation, and the 3 columns are met, unmet, or partially met. So what it does is you have a conversation about what is the current practice in your home to the evidence-based practice recommendations in the guideline. And so then you can determine, you know, if this is met or partially met, and it really helps you focus on what your priorities are going to be and what you want to do for your next steps as an action plan. And you also, you know, it helps you to develop your baseline criteria to see if you're moving in the right direction. So what Watford did was they used resident complaints as their baseline. A lot of their resident complaints were based on lost personal items. And so they used their champions to try and relabel and make sure things were replaced back to the appropriate resident. And then a lot of the complaints were down. So it really helps you look at what's going on, what the problem is, and what are easy solutions. And I think during COVID, in particular, I say kudos to this home, because on top of all the frequent changes with COVID, they still managed to maintain this person and family-centered care approach in a really good way with really successful outcomes. So they still managed to keep the resident complaints down, which is a huge success story for this guideline, because a lot of the homes are experiencing just the opposite, right? A lot of families were upset, rightfully so. But this home managed to sustain their practice changes, and resident complaints remained at 0, which I think is really commendable. And I really appreciate Watford taking the time to share their presentation and their work. And I don't know, Andrea, if there's any more questions?
No, we have addressed them all. In case anybody has one last question you'd like to type in the box. Other than that, you will be receiving an email from me with a link to the evaluation and certificate. And in that email, you'll also have a copy of the slides and Kelly and Bev's email addresses. Okay,
Thanks again, everybody, for joining. And have a good afternoon. Great job, Kelly.
Oh, I was so nervous.
No, you did a great job. Thank you.
Thanks, everyone.
Bye-bye now.